I rise in support of this bill. It's not a perfect bill. It's not even a bill that many of us who supported this concept for a long time imagined would be the final product. I want to thank everyone in the gallery who've worked so hard and waited so long for us to come up with even a flawed bill. I want to respond to a few things that were said. I empathize enormously with what Senator Libous is going through personally, and he's absolutely right. Probably few of us haven't had personal experience or experience with our family members having gone through some similar experience at this point in our lives. But no one has said, or I don't think they meant to say, that anyone has an expectation that this is a cure. Medical marijuana, in all the various discussions and all of the research that I have seen, talks about it having a palliative care ability, that it can actually address symptoms, sometimes extremely excruciating day after day symptoms and behaviors caused by the underlying disease. So yes, we must continue to search for cures. And someone said, but we don't know enough. We need the research. Well, I just want to point out, I agree, more medical research would be incredibly valuable. The problem is the federal government's policies don't allow us to hand it to the FDA, don't allow doctors who apply for research grants to even do the kinds of research we're discussing on this drug because of flawed and failed federal policy. But we do have a decent amount of research that shows us this can and does work for various people under various circumstances. Now, and I'll go back to that in a second. It's also true that doctors have a standard of doing no harm. And the good news for those of us who feel there's not yet enough research and it's not a cure is that the research has been done enough to show us that marijuana is far less dangerous a drug to use for these illnesses than most of the drugs that are legally prescribed. There's research showing that there's never been an overdose from medical marijuana or even non-medical marijuana. There's research showing just the opposite for some of the most commonly prescribed drugs for the disease categories that were listed out by Senator Savino when she was explaining the bill. So the concept that this could increase risks for people is the kind of research we actually already have and know is not a concern and should not be a concern for us. It was also raised that there's concern by some that use of medical marijuana can, in some cases for some people, be addictive. And there's research on that as well, which also shows many of the kinds of drugs that are prescribed for exactly these illnesses are far more statistically and scientifically addictive than any of the ingredients within cannabis. So we already do find ourselves in a situation where as a country, as a world, we recognize that even though some drugs that are prescribed under law are dangerous, can cause illness, can cause death, can cause addictions, we make the decision that when prescribed by a physician, we believe that it is the best option, even though there are risks associated. You can't watch television at night and not see a TV commercial for fill-in-the-blank drug and see all of the, in small print or announced at the end, the list of possible dangers associated with that drug, the list of possible side effects associated with that drug, the risk of death from taking that drug. And yet, we recognize those as not only being legal and prescribable, we understand that for many people, it's worth the risk to face bad side effects, addiction, and perhaps even death, because the alternative for them is worse. And yet, with all the things we don't yet know about marijuana, because we have a national policy that doesn't let us do our homework, we do know that marijuana has far less of those serious risk concerns than a huge percentage of drugs that are already approved and prescribed throughout this country. It was also mentioned that at least one medical society has not weighed in support of medical marijuana. But there's a huge number of medical organizations and famous medical providers who have weighed in. And just to list a few: the American Nurses Association, the former chief administrative law judge at the U.S. Drug Enforcement Administration, Francis Young, the New England Journal of Medicine editorials, the American College of Physicians, the American Academy of HIV Medicine, the former U.S. Surgeon General, Jocelyn Elders, the National Institute of Medicine, the HIV Medicine Association of Infectious Diseases Society of America, the British Medical Association, the American Association for Public Health, just a few of the medical experts and professional associations and research arms that you can read all of their analysis of why this is the right answer at this point in time, even though we want more and better options for people with these illnesses. We do want cures for people with these illnesses. And I also know, I've spoken not only to patients, but I represent a district that I believe has more hospitals per person than any other district in the state. It's sometimes nicknamed Bedpan Alley, the east side of Manhattan. It includes the hospital, in fact, that Senator Libous is getting treatment at, a great, great hospital. And I have been there visiting friends who have also been going through cancer treatment. And I've had doctors say to me, please pass this bill. We send our patients home knowing how sick they are getting from the treatments. We can't bear the fact that we're suggesting to them under the table and quietly, you might try some marijuana, it might help. They know that it's illegal for them to even whisper this. I've even had patients say, I really want to try it, but I know it's illegal. My grandchild's offered to get me some. I don't want to put them at legal risk. I'm assuming sometimes their grandchildren or children get them that drug anyway because they care about their family member. I'm assuming there's a decent number of doctors in the state who secretly whisper, you might try this if you can get some. It's a drug that is radically less dangerous, less addictive than an endless list of drugs that we can find legally approved by the FDA. Do we have all the answers? No. Do I wish there were other changes made in this bill? Yes. Should it be disturbing? It can be 18 months before we actually implement. For many of the people in this gallery, absolutely. But surely voting no today doesn't get us any closer to addressing any of the concerns I've heard today on the floor. I vote yes, Mr. President.